everyone. This is Kinesio Kostopoulos. I am the co-founder of Hands-On Seminars, and we have in our meeting tonight, in our webinar tonight, also the other co-founder of Hands-On Seminars, Dr. Konstantin Rizopoulos, but also our distinguished faculty, very good friend, Andrea Wolkenberg, who is a specialist in kinesio taping, and Andrea offers through hands-on seminars a process, a program through which you can obtain your certification in kinesio taping by the International Kinesio Taping Association. And you can see the bio of Andrea here. So as I'm welcoming everybody, I would like to welcome Andrea to our company. So Andrea, good evening.
Good evening. How are you doing?
Doing very good. Actually, this morning I left very early in the morning from the 30-something degrees of temperature Fahrenheit from New York, and I am in Florida, in Miami, for a business trip at about 82 degrees. So I am better than you guys up there north in the New York cold temperatures.
Very nice.
Okay. So, Andrea, first of all, I would like to I'll give you, of course, the presenter.
Hello?
There you go. You can take the presenters now.
Okay.
Lead. And I want to ask you, when we are talking about kinesio taping, where did this method, how did this method start about? And talk to us a little bit about the uses, the general uses of the kinesio taping method.
Sure. So let's start a little bit with the history of kinesio tape. Kinesio taping started in the 1970s. I'm having a little problem here with my...
Just click the down arrow.
There we go. It was invented in the 1970s by a Japanese chiropractor by the name of Dr. Kenzo Kase. And essentially, he was a practitioner, like all of us, and he was having good success in his practice with his form of manual therapy. And but he was having the same problem that a lot of practitioners were having, which is that people were getting better. They left his office feeling pretty good, and then they would come back a few days later or a couple weeks later, and they were not feeling so good again. And he wanted to come up with some way of essentially sending his hands home with the patient. And so what he started playing around with tape. And at that time there was only really rigid tape, and he was not satisfied with the results that he was getting. And somebody, apparently the story goes that somebody handed him a roll of some form of industrial stretchy tape. And he started playing around with that, and he worked with a company to develop his own tape, and kinesio tape was born out of that. And it is a modality. It sort of, as I said, it started, was introduced in 1979. It was introduced in rehab settings in Japan, and made its first kind of international debut at the Seoul Olympics in 1988. And it came to this country in 1995 and to Europe in 1996. I myself took the my first course, I think I want to say in 1999, so pretty soon after it came to the United States, and since then has enjoyed a very kind of broad popularity after after the 2008 Olympics. It really kind of took off when Kerry Walsh, the volleyball player, was wearing it, and was the big kind of hit of the 2008 Olympics.
Andrea, if I'm not mistaken, it was even in this last Olympics, it was very extensively used by many athletes, and it received tremendous recognition.
There were several hundred athletes at this year's Olympics that were wearing the tape, and it made quite a splash, and was in the news and in the newspapers, and there's all kinds of controversy about it, and it's very hot now. But for me, the way that I think of it, to me, it is the most versatile modality that I have, other than my own two hands. And so I'm kind of excited to be able to share this with my colleagues and to work through hands-on, because it is so complementary to everything that we as manual therapists do. The idea of the tape was that, in fact, it was designed to mimic the qualities and the properties of skin. Dr. Kase believes, his concept is that you can affect deeper structures by manipulating the position of the skin. That there are, we have all kinds of sensors that are embedded under the skin that we influence with our hands all the time. And he just came up with the concept of using tape almost as a second skin. That because the skin and the brain are intimately connected through the nervous system and through the fascial system, that we can send, we can sort of bias the brain towards different kinds of responses, and change the motor response through a change in the sensory input via the skin. So the idea is that we use the tape, we put a certain amount of stretch in the tape before we apply it, and we stretch the skin before we apply it, and as the skin, as the tape adheres to the skin and recoils, it actually lifts the skin and repositions it. And this has a very profound effect, because as the skin is lifted, there are many physiological effects that take place. We have a change in the fascial system. We're pulling on the skin. The skin is connected to superficial fascia. The superficial fascia is attached to deep fascia, and we know that the fascia, deep fascia, is attached to everything. So we also have, because we're lifting the skin, and the skin is attached to the superficial lymphatics via some filaments, we are opening up immediately the superficial lymphatics. And that changes the fluid dynamics. We're increasing circulation, we're bringing more oxygen to an area, taking away waste products more efficiently, and that is an almost immediate effect. We can alter the amount and direction of the tape and target different receptors. As you know, There are receptors that are embedded under the skin that are for pressure, pain, proprioception, heat, cold, vibration. And by altering the amount of tension that we put in the tape and affecting the direction also, we can target these receptors. This is the kind of basic concept. So I wanted to just show you, here is this would be a piece of tape, and this was a very well thought out design. You'll notice that the tape is essentially, as I said, a second skin. It's porous, and it acts as a barrier, just like skin acts as a barrier. It allows fluid exchange because it is porous. The adhesive on it, you'll notice, is in a wave-like pattern that is similar to a fingerprint, and that was designed specifically to get the body to accept it. When the tape is placed on the body, you pretty much forget that it's on after about 10 minutes or so. You'll see that there is a weave in the tape that you can manipulate, and as you learn to use it, you can figure out how much tension is in the tape just by seeing the weave. We call it the wave and the weave move, and that takes a little practice, obviously. But so this is basically what the tape looks like, and the glue itself is a heat-activated glue. You have to rub it kind of a little bit vigorously to get it to adhere well, and so that's what the tape looks like. This is a photograph of the tape applied to the skin. I asked a friend of mine to be my model here. So the tape was on a very, very mild stretch, very, very small stretch, and the skin was put on stretch. I had the patient here flex forward, and I applied the tape with very light tension, and when he stood up, this is what you see. You can see how the tape pulls up on the skin and creates these convolutions. And this is what we are looking for when we do muscle taping particularly. This is what we're looking for. We're looking for these convolutions. And here's just another slide just to kind of show you how it's very obvious that the tape is repositioning the skin. For those people who think that this is a purely placebo effect, I won't deny that there is a placebo effect to the tape, just as there's a placebo effect to pretty much everything that we do. It is not the primary effect. The primary effect is this repositioning of the skin. There are many, many, many applications for Kinesio tape. I always say that if you sent me off to a remote place and I was only allowed one modality, to treat, this is the modality that I would take with me, because this is the modality with which I can do the absolute most with. At high tensions, when I put a lot of tension in the tape becomes a compressive force rather than a decompressive force, and it affects deeper structures like ligament, tendon, joint, and I can limit pathological movement with it. When I use it at low tensions, then the effect is much more superficial. I'm affecting the skin, I'm affecting the circulatory system, I'm affecting the fascial system, and I'm affecting the muscular system through the fascia.
Andrea, I'm going to interrupt you for a second
Sure.
to ask a question that I am certain it's been in the minds of a lot of the people who attend the webinar, and definitely it's a question that is in the minds of most manual therapists. You are a manual physical therapist. You have been certified in many of the manual therapy techniques and approaches through hands-on seminars and other organizations. You are a faculty of hands-on seminars. You are a manual physical therapist.
Yes.
And one of the key questions that we had to answer as hands-on seminars, as a continuing education organization that emphasizes, that focuses on manual physical therapy, is how a modality like this, like kinesio taping, enhances the manual therapy techniques that a manual therapist performs with their hands. So can we elaborate on that a little bit? Because when you and Dr. Kostopoulos and myself had a discussion about this issue, I was really amazed about the tremendous effectiveness that you described to us of the kinesio taping having on the mobilized or manipulated structures.
Yes. So I think this is a modality that is uniquely suited for the manual therapist. If we just thinking about kind of what we teach at hands-on seminars, when people take courses at hands-on seminars, you have created these courses which are an eclectic group of techniques. You kind of get the best techniques, right? We teach strain and counter strain. We teach myofascial release. We teach trigger point release. All of these different kinds of manual therapy, and with pretty much each of them, I can come up with an application that furthers the manual piece of the treatment. That if you let me just sort of be a little bit more clear. So you treat your patient and you create, once you've evaluated your patient, you create a problem list. And based on your problem list, you will then apply your manual therapy techniques, your modalities, to achieve the goal that you have set. So perhaps let's just take, for example, somebody comes in with a sprained ankle. Okay, pretty easy stuff. So the first thing you want to do in the acute phase is you want to probably decrease the edema. That is maybe the first thing, that they have edema and they have pain, and that is their main problem. So we would start then with a lymphatic taping, one particular taping. Now I will show you examples of this. We get past that. A week goes by, a few days go by, the edema is down, maybe the pain is a little less, maybe the skin and the fascia has maybe it's a little bit restricted because they haven't moved the way that normally. We could then apply the tape in a completely different way and address the fascial issue. We we want them to start exercising, and we want to start helping them to use their muscles and to get stronger, to support the ligaments. So we would apply the tape in a different way to facilitate muscles that are weak or to inhibit muscles that are in spasm. We can do what we call a space correction. I always think of this as this is like a Band-Aid. We can put a piece of tape over a trigger point. Perhaps they've developed, because they have they've been walking with a pathological movement pattern, and certain muscles are tight, certain muscles are weak. There's muscle imbalance, and they're developing pain. We can apply the tape in a different way to address any trigger points they have. We want to keep them. Maybe they're relaxed.
One second again,
sure.
Because this is something extremely important you're saying here, that we observe with any kind of soft tissue type of condition, any type of soft tissue injury. There are muscles around a joint that will be tighter, and other muscles that will be more laxed, more weaker. And that creates, as you said correctly before, a myofascial imbalance. And there are many ways with manual therapy to correct that myofascial imbalance. But
yeah.
You correct it, but then the patient returns back to their regular activities, and there might be several perpetuating factors that can perpetuate that patient's condition, and you are not able to control it. The tape is something that will exercise greater control when the patient is not with you.
Right. So if, for instance, you have somebody who sits at a desk, and we can do postural correction with that patient in the clinic, and we can do our manual therapy to let's say they're a forward head, round-shouldered person that we see kind of all day long in our practice, and we can do our manual therapy, and we can open up, stretch the pecs, and strengthen the rhomboids and the lower traps, and we can work on their posture. Well, we can send them home with tape that does exactly what we've done with them in the clinic. We can send them home with tape that inhibits the pecs, allows the pecs to stretch, that facilitates the rhomboids, facilitates the lower traps. I'm just going to give you some slides here. This is just an example of somebody coming in might have some swelling. So the first thing we would want to do is do some edema management. And you will see as this person moves their arm, you can see how the tape wrinkles forward, back. And this creates not only the channels in the skin. Remember that fluid moves from areas of high pressure to areas of low pressure. If we create channels of lower pressure, the fluid is going to move in that direction. But it also, by changing the skin, the movement of the skin, sort of constantly as we move, we're activating the body's own endogenous analgesic system, that we're gating the pain. Where it's as if we were rubbing the skin with our hand, but we're using tape to do that. So there you have one example of how it works with pain. This is just a fancy kind of fascial correction. I just wanted to show how you can apply a piece of tape to pull the fascia multidirectionally. And as this person moves, you can see how the tape lifts the skin in different directions. And the way that you apply the tape is not, there is no cookbook. I wish that there were a cookbook. We teach you techniques, we teach you some standard applications, but your application is going to be based on your evaluation, which is exactly what we teach in our manual therapy courses. Here you have an inhibition of the pec major, and it is paired with a facilitation of the rhomboid. So this would be an example of trying to get some muscle balance between the agonist and the antagonist. And by the way, this is not just for orthopedics, okay? You can influence the tone, muscle tone, in neurological patients. I have been quite successful, and much to my surprise, with a patient that I've had that had blew an aneurysm and became a hemi and was going into very, very bad sort of flexor synergy, and I taped her. I inhibited her biceps and I facilitated her triceps, and she was markedly improved. Not perfect, obviously, but markedly improved within the next time she came in. Here you have, that's my cat. Here you have a space correction, what we call a space correction, that we put right over an SI. And what this does is it pulls up, right, pulls the skin up right over the SI, and it creates an almost immediate pain relief. Okay, if there are times I'm sure people do skin rolling. This would be a sort of substitution or an additional way of doing that, of lifting the skin. Many of our patients have go into pathological ranges of motion, or hyperextend at the knee or hyperextend at the elbow, and we want to give them a proprioceptive input to keep them from going into that pathological range. So we can apply the tape to do just that. So here we're applying it so that the patient cannot, or if they can overcome the tape, but the tape will give them a sense of, don't go any further than this. And it will keep them in a safe range of motion. We can do joint mobilization with our hands, and we can do joint mobilization with the tape as well, and ligament support with the tape. Certainly, if your main reason for applying tape is joint protection, I would go with a rigid tape. But this is a more proprioceptive. You can wear this tape, a long time, and it's on the body a long time. So this is, here you have, we're doing an ACL correction for this guy here. And they have full range of motion, which is another nice thing about the tape. It does not restrict range of motion. It allows full range of motion while protecting them. This is an example of a postural correction, somebody who slumps. I apply the tape so that when they sit at the desk or stand and they start to allow their shoulders to round, that tape is going to give them a proprioceptive reminder. Don't do that. It's like the therapist is there with them. So there are just all kinds of uses for the tape. And it is, what I love about this tape is that it's not just for athletes. And I know that most therapeutic taping is marketed to athletes. We think about it for our patients who are involved in sports. But we have used, there are practitioners who have used Kinesio tape on preemies, on premature babies, and babies who come out with Erb's palsy. We use this tape on our geriatric patients, in nursing homes, treating a 95-year-old lady with a knee problem. I can use the tape. And as I said, it's not just for orthopedic problem. It is used to treat lymphedema. It is used to treat neurological problems. It's used to treat postural insufficiencies. you know, there's just a whole host of applications for the tape. I love the fact that you can wear this tape for an extended period, for 3 to 5 days. One can shower with it. You get a therapeutic benefit. You're not just limiting motion as you do with other kinds of tape. You are actually getting the therapeutic benefit of the increase in circulation, of the fascial repositioning, the skin repositioning, as long as that tape is on for those 3 to 5 days. And you can change the way that you apply the tape based on the needs of the patient and based on your evaluation. You can use this tape through the entire cycle of injury, and you can change the intention of the tape. I always say the tension, your intention determines your tension. You can put a lot of tension in the tape and make this a compressive application, and you can put a very light amount of tension in it and make it a decompressive application. You can use this tape with, pretty much any other modality. You can ice before, during, after. You can use electrical stim with it. I love the fact that you can do neuromuscular re-ed use your Russian stim and put tape around the muscle group that you're working with to give extra proprioceptive input. We use biofreeze a lot. You can biofreeze before, and you can actually refresh the biofreeze through the tape because it's a porous tape. You can just spray right over the tape and get that effect as well. So it's a pretty cool modality and has lots and lots of uses.
Definitely, Andrea, it's very exciting for all of us at Hands-On Seminars to welcome your not only your webinar, but also your courses and certification sequence program. And I would like at this point to open the floor to any questions from anyone who has a question, and you can ask your questions either by typing it, or by actually click the raise hand feature so I can unmute your microphone. And we have a question from Ulissa Young. What are your feelings, and have you used other tapes like leukotape?
Leukotape? Yes. Well, leukotape, this is a rigid tape, and I'm for anything that works. And leukotape, which is used for McConnell taping, is a very useful modality. It's a little bit, though, of it's a Johnny one note. Okay, it does one thing, and it does it well. And I'm not one who bashes other tapes or other kinds of tape. And I do use leukotape in my practice, and I do some McConnell taping in my practice. And I think it is a very valuable modality. It's mostly used essentially for biomechanical effect on joints, right? For instance, correcting a lateral tracking patella, let's say. There's a lot of tension in the tape. The downside to leukotape is that, one, it has a very aggressive glue on it, and you have to put some other kind of tape underneath there, or some foam or something like that, because it can be very damaging to the skin. You can't put it directly on the skin, and you can't wear it for very long. It's not very comfortable. You can wear it for 18 hours, 24 hours maybe, but nobody wants to wear it too much longer than that. What it does, it does well, and it gives a lot of proprioceptive input. So I'm all for it. I happen to use Kinesio much more because it's better tolerated. Yep.
Andrea, I'm going to jump in because I have a barrage of questions. So
Okay.
Jessica Silva is asking, when you say you can use it with e-steam,
Yep.
would the tape go around the area with the electrodes, or can the electrodes sit directly over the tape?
You would not sit the hi Jessica. You would not sit the electrodes directly over the tape. Taking, for example, let's stick with our lateral tracking patella. You would place the electrodes on the VMO, and you would put the tape around the muscle. You would apply it in what we would call we would do a muscle facilitation, a muscle application. We would facilitate the muscle. We would anchor the tape proximally or towards the origin, and we would lay down our tape and then stretch it towards the insertion, or what we call the distal attachment, and kind of go around the electrodes.
Thank you. Thank you, Andrea. Swetha Krishnaswamy is asking, what type of tape would you suggest that can be used with children?
I'm not quite sure how to answer that. Children, just to do what to children exactly? What are we trying to accomplish?
Okay, so in other words, Swetha, we need more information.
We need more information.
What is the purpose of it? What specific action? Do you have a spastic diplegic child that you are trying to inhibit tone? Just be a little bit more specific.
Yeah.
Mizui Luamoto is okay, like upper extremity inhibit tone. What type of tape and how she can inhibit tone in the upper extremity? Swetha is asking.
Okay. Now, bear in mind, I am not a PEDS person. I just want you to know, but this is a general question. I can answer this one. The way that you apply tape, Kinesio tape specifically, to inhibit a muscle is you apply it. And by the way, I'm saying these things very generally, but you know, there are very specific ways of applying it and how much tension and where you put tension in the tape and all of that. I can't do that in a 1-hour webinar. But
sure.
Essentially, you anchor the tape. You place the tape, start on the insertion, or what we call the distal attachment, and you stretch the muscle, and then you lay down the tape towards the proximal attachment, or the origin, with extremely light tension. You don't put much tension at all in the tape.
Okay. I know, guys, there are a lot more questions, but I'm going to just address only this one as last question because we're getting to almost exceed your time, our time, and I'm going to pick here Mizui's Luamoto question. I thought about using Kinesio tape for groin pain before, but because of the location, I decided not to. Do you have any suggestions? Mizui is asking.
Did she say groin pain?
Groin pain.
Groin pain as a result. Okay, so let me be really clear about this. If the groin pain, if somebody has a pulled groin muscle, an adductor strain, or a psoas.
Let's say a hip flex or a psoas or a
psoas.
femoris.
Yeah, there's no reason not to use the tape. You know, we obviously have to be very professional about this, and we need to explain what we're doing to the patient, and we have to make sure that you know, you don't want to tape over any hair or anything like that. You have to make sure that they go and they, you know, before they get taped, that they shave, they get rid of any hair that's in the area. But there's no reason not to tape for groin pain. If you have a situation where there's sort of, it's a male-female thing, you bring somebody in the room of the same sex as the patient. to protect them and yourself from any issues that could arise. But there's no reason not to. I would definitely. I think this is a great modality for something like a psoas strain, which is very hard to treat. And you can get really immediate results in pain reduction with people who have a psoas strain. It's pretty remarkable, actually.
Any final words from you, Andrea?
Well, I would just say that if there's people want more information, to certainly come to go to the hands-on website or go to the Kinesio taping, www.kinesiotaping.com. You can get a lot of information there. There's research there. We have a symposium coming up in June in Stanford, California. With all the kind of latest research and a lot of interesting information, people doing really interesting things. They're taping animals now. They're taping Kentucky Derby horses and flamingos, believe it or not, in zoos. So this is a place to get information, and I hope that if you want to come and get certified in the technique, by all means, sign up with hands-on seminars. The first class is a 2-day class, KT1 and KT2. We learn basic muscle taping and advanced corrective techniques in KT1, KT2, and then KT3 is the certification class. So it's only 3 classes to get certified.
And Andrea, real quick, because my friend here, Jessica Silva, has been very persistent in her questions, in her questioning. So I can't close the webinar before you answer her question, which is, what is your feeling about, let's say, some other brands, especially the pre-cut versions?
Other brands of adhesive that are
marketed as Kinesio tape.
Okay. So this is my feeling. Okay. I don't use any other. I know what the properties of Kinesio tape are, and we have tested. Not when I say we, not me, but Kinesio Taping Association has tested most of what I call the copycat tapes, because most of these tapes did not come on the market till 2008, actually, till after the 2008 Olympics. Kinesio has been around 35 years. Okay, it's tried and true. I know exactly what the properties are. The properties of other, I'm not saying they're bad tapes. I have no opinion as far as that goes at all. But I can tell you that the properties of those tapes, all of those tapes, every single one of them, has some of the properties of Kinesio tape, but none of them has all of the properties of Kinesio tape. So if you learn the Kinesio taping method, it does not mean that you will get the same results from other tapes, other elastic therapeutic tapes, that you will get from Kinesio. Furthermore, there is constant research and development happening at Kinesio, and I can tell you, I can't sort of really tell you, but something's going to be announced very soon, and it's always being improved. So I would just say that are you gonna go with with the brand name, or are you going to go with brand X? That's sort of how I feel. I usually go with the brand name and what I know, and this is what I know. I'm not saying that the other tapes don't work or they work differently. None of them have the educational component that Kinesio has, and none of them, as I said, have all the properties of Kinesio. They're different properties.
Andrea, thank you very much for your time and tonight's presentation. And those of you, my friends, who want to find more information and to become certified, go start the process of certification, please go to the Hands-On Seminars website. Hands-On Seminars will offer these courses throughout the states. We're starting with Rhode Island, New York, of course, Miami and Lakeland, Florida, and other locations will also be added very soon. So I would like to, on behalf of Hands-On Seminars, I would like to thank all of you who attended tonight's webinar. And Andrea, thank you so much for doing a great job explaining this very unique concept tonight. And I would also like to inform the people who are attending tonight two things. One, that very soon, in about a month from now, make sure that you check the issue of Physical Therapy Advanced for Physical Therapy, that will feature the Kinesio taping process by Andrea Wolkenberg. And also those of you who are planning to sign up for the courses, I want to let you know that obviously I have inside information that in approximately 6 weeks the prices of the certification program will be changing, will be increasing. So those of you who are interested in signing up for the sequence of courses that can help you to achieve certification, please make sure that you go to handsonseminars.com and you sign up for these courses. Once again, thank you all, and a reminder, go also to the webinars tab on the Hands-On Seminars website and sign up for the rest of our webinars. On November 27th, Tuesday, November 27th, we're going to have an amazing webinar on the muscle energy technique for shoulder pathology with Janelle Allen, senior faculty of Hands-On Seminars. So good night to all of you, and once again, Andrea, thank you so much.
Thank you.